My name is Craig Wright, orthopedic surgeon at OrthoEast. Specialize in orthopedic trauma surgery as well as total hip replacements. I was interested in healthcare. I actually started out thinking about healthcare finance and management. Got through some classes in college and I transitioned to more of the clinical side of healthcare. So kind of backtracked a little bit after my junior year of college, did my pre-med stuff and decided I wanted to go to med school at that point. My mom's a nurse, that could have something to do with it. I also have a twin brother who's also a doctor, so some genetics I'm sure might be involved with that as well. But then through that, then we started medical school. Orthopedics kind of just naturally fit for me, kind of mechanics of it and what I was interested in. I was definitely interested in surgery, and then through medical school, rotating through the different subspecialties of surgery, orthopedics definitely was my fit. Mostly still what I do is trauma, but I do have a more elective patient population where I get to meet patients in the office, we review what's going on, a history, physical kind of thing, establish a relationship beforehand, and then come up with a plan for hip replacements. So the hip replacement surgery, this minimally invasive or less invasive approach, in terms of getting people back to function sooner, I do it robotically. The robot part of the surgery just helps to make everything more precise. If we have technology that can make everything perfect, I think we should use it, and I think it does benefit people. They go home the same day from the surgery for the most part. They're walking in the recovery room and they notice an immediate change in what they're experiencing. And people were almost instantly thankful that they had it done, because living with hip arthritis or any arthritis, it's debilitating. It affects your whole life. It takes over your sleep, your activities, your quality of life. So people, for the most part, are really happy that they did it. It's a really, really good surgery that can really help people, and I really enjoy doing it. The trauma patient, there's a saying that trauma isn't random, right? You get a phone call from the emergency room, you never know who's going to be what patient's going to be in that bed when you show up. I can't say, well, I'm not going to fix your femur because you're overweight and unhealthy kind of thing. You have to fix it, right? You can do that for elective surgery, hip replacements, knee replacements, ACL, things like that. You can say, no, you're not a candidate for this. With trauma, it's different. You have to take who are all comers, because otherwise they're not going to ever heal. So that does change the variables a lot, does change how we manage them. It's same surgery in some ways, but the outcome could be totally different. Patient motivation, in 1 second, your life is normal. You're driving your car, you're at work. Split second, your life is totally different. You can't plan for that. So there's a whole mental part of the trauma side of it that patients experience, and trying to keep people positive and optimistic is a challenge, it takes time, but I do enjoy it.